I'm so excited to have Dr. Dominique Brüssow with us. She's a chiropractor.
A chiropractor is a doctor that deals mostly with conditions of the neuromuscular skeletal system. So that's anything to do with muscles, joints, nerves.
Let's say I wake up with morning stiffness. Now I've got an option to either go to my GP, go to a physio, go to a bio, go to a chiro. How does one differentiate when to kind of go see which professional?
Okay. You've had something for a long time, your body will have formed a memory of it and a pattern of it. So we need to break down that pattern.
Yeah.
Older patients, we don't recomplik. Really.
Yeah, for sure.
Yeah.
Welcome to Fill in the Blanks podcast. I'm Ilanie, your host, and for the month of April, we'll be focusing on holistic health and well-being. I'm so excited to have Dr. Dominique Brüssow with us. She's a chiropractor, and I can't wait to dig in exactly what she does and how she can help our patients. Dominique, welcome. We're so happy to have you.
Thank you for having me.
Awesome. So tell us a little bit about yourself.
I grew up in Pretoria. I was homeschooled as well. My dad was a dentist, and so from there came the love of the human body, if I can call it that. I just always knew I never wanted to be a dentist. Pulling teeth wasn't something I could ever see myself doing. So I guess I wasn't really sure exactly what I wanted to do. I just knew that I didn't want to do that thing. But I knew what I was passionate about and that I wanted to help people. So I think when I was in my matric year, I started looking into different things that you can go into. Started shadowing people and finding out what other people are doing and so on and so forth. And so my family, we pray a lot together, and all faith is very deeply rooted in God, and so we just tend to ask him about everything before we do it. And we just decided that this was a serious thing, deciding what you're going to do for the rest of your life. So we made a habit out of praying every day. When everyone was done with school or with work, we'd come together and then we'd pray about it, ask God to show us the way, and just so that, when the next year coming, if you're going to study, if you're going to work, if you're going to gap year, what are you going to do? Just so that he guides you in the right way. It so happened that later on during the year, I was feeling very panicked because I hadn't decided what I wanted to do, had no idea what I wanted to do the next year. And this one day, my mom had an appointment with a chiropractor. And they had to fetch me from one of my extracurricular activities and take me home first. But there was a little time issue, so she couldn't do that. And I had to go with her. This was my first encounter with a chiropractor. And I never knew about chiropractic before that. I didn't know what it was. But this doctor was just so enthusiastic. I mean, she connected with me immediately, and she was so passionate. And I hadn't seen that with anyone else that I'd been talking to. No one else was that passionate about their work. It was a job for them. Yeah. So she just really inspired me. And I went home that day. I looked up chiropractic because I had no idea except for what I'd just seen. And I started doing some research, and then I decided, let me see where I can study this. I hope I can study in South Africa. That's the first thing that I was worried about. And yes, we could study at the University of Johannesburg, had a chiropractic course. So I enrolled for that. And the cutoff date for applications was actually the next day.
Wow.
So if I hadn't been at that appointment on that day, I would have missed it completely. And I just know that afterwards, I just knew that, God was putting me on this road, and that this is what I was supposed to be doing. And I've enjoyed it every step of the way, even with difficulties that we've had with travel and all that, getting to campus and back and everything. I just always knew that this is what I had to do. I was going to do this. And I love it. I absolutely love it. I've never had any regrets about chiropractic.
That's something I really love about you and admire about you. Like, your passion is palpable. One can really see in every interaction I've had with you how passionate you are about what you do, but also about the patients that you help. So tell us a little bit more about what does a chiropractor do? What type of patients do they help? I understand that oftentimes we have a misconception about what a chiropractor actually does.
Okay, so a chiropractor is a doctor that deals mostly with conditions of the neuromusculoskeletal system. So that's anything to do with muscles, joints, nerves, the skeleton, basically. So those kind of conditions, those are the ones that we can help with. So we use manual therapies. We don't use medications. We don't do surgeries or anything like that. Everything is what we can do with our hands. That's what we use to help our patients. We believe that the body and the nervous system responds to the input that we give it. So if you're not giving a stimulus into the body, then it cannot respond to anything, so it won't do anything. The brain is very good at looking at your environment and adapting to the environment. So a lot of times you'd have a niggle or something that's bothering you for months, and after a while you notice that, oh, it's not really bothering me anymore. Only when I do certain things there, then I notice it. But that underlying pain, you've sort of gotten a new baseline for that. And that's just your body consistently adapting to your environment. But this thing that you now have, this underlying, say, imbalance that you have, is actually affecting other parts of your body as well, because you're working with movement and movement chains. And if one part isn't contributing, that means other sections will start to compensate or will have to work harder. And then when you get a body part doing something that it's not supposed to be doing, it gets tired quickly, it wears out quickly, you get injuries and you start getting pain, you start getting things like arthritis and those kind of things. So we look at movement. The first thing we do is we see what part of your body isn't moving the way it should be moving. And we focus specifically on the spine, because your nervous system runs through your spine. And from there, if you can affect the movements in the spine, then you can have an effect on the other areas that are supplied through the nervous system that come from the spine. So we look, like I said, first of all, we look at movement. We don't chase pain. You might tell us this is where we have pain, and we know that muscles have specific pain referral patterns. We know that your nerves have specific pain referral patterns, but we look at movement first and see what isn't moving and what isn't moving properly and what is painful to move. And then that is what we work on fixing. We believe that movement is medicine. If you are moving your body, then you've got this beautiful reaction that happens in your brain. It's getting stimulus. You have receptors in your joints that actually tell your brain what they are doing. And if you are getting information from those receptors going to the brain, then the brain is going, okay, I still have that, so I can still move it. So that's one of the big problems that you have with people, especially nowadays when you have a sedentary lifestyle, you're not moving a lot, is your brain isn't getting input that a joint or a particular body part is there. And then it kind of forgets that it has that to use when you want to move around. So this is why people start feeling stiff, and this is why you start feeling sore when you're moving, because you're not moving enough. And I always say that joints need to be lubricated. So the more that you move it, the more you lubricate it, which means the more nutrition it gets, the healthier it is, and also the better it moves. If you move better, then you will also perform better overall.
So I think obviously with elderly people, they become more sedentary, and that whole principle of use it or lose it is really prevalent. Oftentimes when we start looking after elderly patients who's very sedentary, they don't want to move. They can, but they don't want to. And it's quite a vicious cycle, because the less they move, the more pain they have, the less they want to move.
Exactly.
So what do you advise families with loved ones that are elderly, that complains about pain? They don't really want to move, although they can, and they just actually want to be sedentary. They want to sit in front of the TV the whole day. What would you advise family members like that to do?
So this is a difficult thing to overcome, because you have to get someone to want to do it. But we always say any movement is better than no movement. So if you can partner up with your family member and be an accountability partner for them, take them out for walks, involve them in little activities that gets them moving. First of all, involving them in the activity is already giving them a sense of belonging and but doing the movement itself not only will help loosen up joints, which will help with stiffness and that kind of thing. It will help with pain management and preventing pain.
Yeah.
But it's also going to have an amazing effect on the brain. They're going to feel better. And the more that they do it, the more they're going to realize that it's having a positive impact on them. They're going to want to do it. But at first, you have to persevere. The first 3 weeks are going to be hard, but building a habit and building into a habit, once people realize how amazingly profound the effects of movement are, most people want to stick to it.
For sure.
Yeah.
For sure. And I think you are touching on something extremely valuable here is, firstly, a patient is not an island. We need input from family members, caregivers, the multidisciplinary team, someone like yourself, to give input to a patient. So often we work with patients that family members are not always able to be part of that process. They either live abroad, they work full-time, they'll often get us in. And, that's where we can step in from Kriel Care's side to really facilitate that under leadership of the multidisciplinary team, a professional like yourself, and also encourage a patient to move better, to participate in walks, to participate in things as much as possible. So I think the whole concept of what we're focusing on this month is, whole person wellness. And that just speaks again to physical wellness, also contributes to emotional wellness, also contributes to mental wellness, right?
Absolutely.
So at what point should someone come and see you? Let's say they are a bit stiff, there is a little bit of pain, they are starting to move a bit better, they are going for their walks and things like that. But at what are signs that people need to look out for to come and see a chiropractor?
The signs that you look out for, well, first of all, is waking up with morning stiffness. If you've had a good night's rest and you're waking up and you're feeling stiff, that's
Is
not
that
normal.
Like stiffness in your limbs, in your back, in your neck? Like where do people often get that stiffness?
So a lot of people will first get stiffness in their back.
Okay.
So then they'll tell you, I wake up and then I have to first stretch, and once I just get going, then I feel okay. Now I can move. But sometimes I struggle to just get out of bed and stand up straight. Yeah.
Okay.
So that's the first thing that you need to look out for. Another thing is if you notice something like there's a change in your movement range. For instance, if you're still driving and you want to look into your blind spot and you find that, oh gosh, I have to strain myself to be able to see this, but usually I could see them, or I could see perfectly fine without having to put any effort into it. This is a change in your range of motion. This is also a sign that's telling you need to come to a chiropractor because something is changing. And the last one is if you're experiencing pain on everyday activities that you usually do. So for instance, if you're brushing your teeth and you bend over to spit out into the basin and you're feeling pain when you're doing that, it shouldn't be painful. So normal day activities, if you're feeling pain while you're doing that, then that is also a warning sign. Then you need to come to a chiropractor.
Okay, so just because people don't know, let's say I wake up with morning stiffness. Now I've got an option to either go to my GP, go to a physio, go to a bio, go to a chiro. How does one differentiate when to kind of go see which professional?
Okay, so physios and biokineticists work mostly with rehab conditions. Okay, so they work on different phases of rehab. Chiropractors because we are doctors, it's better to go to a chiropractor first because we can diagnose conditions, and we can also, if we are not able to help you, refer you to the right person who will be able to help you. A lot of times someone will just give you a muscle relaxant or anti-inflammatory or a pain stiller. Just taking pain medications, just switching off an alarm. It's not treating the underlying cause. So I would definitely suggest going to a chiropractor first. What we do is we give the brain input, and that allows it to heal itself. If you have been to a chiropractor and they were not able to help you, then they will refer you to the next person along the line. But this is, like I said, it's non-invasive, it's manual alternative and conservative therapies that we do.
Yeah.
So if you need medication, then we can talk about that and we can refer you to someone who can assist you.
Yeah.
If you need to be referred to a specialist or a surgeon or something like that, then we can assist you. But we always prefer that when you look at healthcare, that you start at the bottom.
Yeah.
You know, don't start with operations. I mean, if you're getting an op first thing, you haven't tried anything else. That's the most invasive thing that you can do.
Yeah, for sure.
So I always recommend start out with a chiropractor and take it from there.
Yeah. Okay, yeah, it definitely makes sense. It just, a lot of times people contact us and they're not sure where to start. They're like, I don't know where to start. And I think you're touching on something very valuable to say, look, you guys are a first point of call or first point of contact. If you cannot assist or if you see that there are other warning signs, you can refer to other professionals to assist, right? So just what does a general treatment plan look like more for your geriatric patients? So let's say it's a general patient with Alzheimer's and dementia with general weakness and some pain because they're sedentary.
Yes.
What does a assessment and then a treatment profile generally look like for someone like that?
So for with regards to assessment, we also always take a medical history. So if there's someone who can assist with an Alzheimer's or dementia patient with the history, that's also always better. We then also try and find out as much as possible about what they are actually doing. What is their environment like? What are they able to do? What do they not do? What do they do most of the time?
Yeah.
And we look at their habits and maybe hobbies and things that they also are busy working on on a daily basis. If someone is sitting and reading in a chair like this the whole day, I can imagine eventually they're going to start slouching to the one side or to the other side, and that can be very bad. And if you're not getting up regularly or walking around regularly, then your muscles are going to start getting stiff and sore. So we look at the environment as well to see what is in the environment and how can we bring something into their routine that is going to help them, or at least give them breaks in between where they can actually just stretch themselves a bit, just change their posture.
Yeah.
Because a lot of times all you need to do is just change the position that you see it sitting in regularly, and that already makes a huge difference. So we look at that, and then we will make recommendations for them and for their caregiver as well.
Yeah.
Then we'll do an assessment. So we'll look at the movements of the muscles and the joints and the nervous system as well, challenging some of the joints and the muscles and see exactly what is causing their discomfort, what is causing their pain. And then the treatment will usually consist for older patients. We don't rack and pluck.
Yeah, for sure.
Yeah. So usually it's I'm going to say warm and fuzzies, but we do things like massage and those kind of nice therapies to just loosen everything up and get it nice and warm. We use heat therapy, we use stretching and gentle mobilization. With regards to that, we will then assess to see how well they respond to the treatment a week later. And after, we'll check in with their caregiver as well and see if they are actually implementing the recommendations that we gave, and if it is changing, if they are improving or feeling better. Depending on how long they have had the discomfort or the pain, that will generally tell us how many sessions would they need. Okay, because if you've had something for a long time, your body will have formed a memory of it and a pattern of it. So we need to break down that pattern. So for some people, their bodies bounce back quite nicely and they get 2 or 3 sessions and they respond very well. And then when they go and implement what we've taught them, then it can keep them going for a while. But other people, they need to come more regularly. It can be up to once a week. Sometimes they go once every 3 months, just to maintain their bodies and help them to keep moving.
Okay, so what I'm hearing is it's very important to comply with your recommendations from the patient's perspective. So either family members or the care partners need to make sure that your recommendations are implemented, but then there's a continuous process of monitoring
Yes.
as well.
Yes,
Right?
absolutely. Yeah, we check in with them a weekly basis at first, and then if they are on maintenance, once every 3 months.
Okay, awesome. Because I think, especially with our elderly patients, maintenance is very important. You know, you can't just go for one session and then hope for the best. I think if you want good outcomes, in the end, you go for the assessment, you go through your recommendations and your therapy, you check in, and you're on a maintenance program,
Yes,
right?
yes.
So what I'm really hearing, and that is really the theme of this month, is that whole person wellness really is an effort where patient, family, care partners all work together towards a patient's well-being,
Yes.
right? Dominique, thank you so much. I think it was so insightful just for our audience to understand what a chiropractor actually does, when they should consult, and the value of your treatment process is. If there's any final words that you would like to give our audience, is there anything final just around movement? Movement is medicine, or chiropractic, or looking after, you know, we look after patients with chronic illnesses, with quite severe changes in their lives. Just a word from your side, if you have any.
Yes, I think I always like to say, like I said before, any movement is good movement. So as long as if you're moving, your body knows that you're alive and that you can still move. So whatever movement you can do it. It's very good for you.
And on a continuous basis,
On
not just once a month.
No,
you know.
consistently over time. That's the thing that keeps you going.
Awesome.
Yeah.
Thank you so much. So this is Dr. Dominique Brüssow. Thank you so much for coming. This is Fill in the Blanks podcast. This is Ilanie. Catch us same time, same place next week.